Evaluation. Evaluation is the fifth step of the nursing process, follows the implementation of nursing plan of care. In evaluation phase, nurse determines/checks whether the plan of nursing care worked or not, i.e. goal is achieved or not. In simple words, evaluation involves checking the outcome of care. If the outcome is positive, then the evaluation is the last phase. But if the outcome and care is negative, then nurse have to do a complete thorough reassessment of the entire plan of care. Definition. According to Craven 1996, evaluation is defined as the judgment of the effectiveness of nursing care to meet client goals. In this phase, nurse compares the client's behavioral responses with predetermined client goals and outcome criteria. According to Dugas 1995, evaluation is the continuous process in which nurse assess and reassess the program patients have made towards reaching the pre-established goals. Evaluation is a comprehensive, in-depth critical judgment, done to determine whether the goals are attained and outcome criteria is fulfilled. Purposes of evaluation. Collect data for making judgments about nursing care delivered. Determine client's behavioral response to nursing interventions. Compare the client's response with predetermined outcome criteria. Appraise the extent to which client's goals were attained. Appraise/appreciate the involvement of client/family member in healthcare decision. Assess the collaboration of client and healthcare team members. Identify the errors in the plan of care. Monitor the quality of nursing care. Activities in the evaluation phase. Evaluation phase of nursing process involves following activities. Review client goals and outcome criteria. Collect data. Measure goal attainment. Revise and modify the nursing plan of care. Review client goals and outcome criteria. Review the client goals and outcome criteria of nursing plan is very important to measure the goal attainment. Nurse will judge the attainment of goal by measuring the outcome criteria of planning phase. Collect data. Subjective and objective data is collected systematically to evaluate the goal attainment and outcome of care. Collection of data is also helpful to determine the effectiveness of nursing care provided. Sources for collecting the subjective data are client, family members, nursing personnel, other health team members. E.g., if the nursing diagnosis was pain related to disease condition.
Goal: client will state that pain is relieved within 15 minutes after medication. Sources for objective data are observation, skin color, rashes, medical records, diagnostic test, health team members report. Physical assessment, bowel sounds, and measurement devices, BP, temperature, etc.
Measure goal attainment. After collecting the data, nurse forms a picture regarding client's behavioral response to the predetermined outcome criteria, i.e. nurse compares the client's action with the predetermined goals in planning phase. She will do the following activities. Make a list of goals that were already set in planning phase. E.g., client will take 500 ml liquid/fluid intake in half an hour. Nurse will assess what the client is able to do in relation to the goals. E.g., can client take fluid orally by self? Nurse will compare. Can the client do every activity set forth by goal? How well does he perform activities set forth by goal? Has the goal been partially or completely met? Involve client actively. Discuss goal, outcome criteria with him. Encourage him to ventilate his feelings whether or not he has achieved goal. Discuss with client/family/health team members whether the goal is achieved easily or slowly or faster. E.g., whether the client drink liquid before half an hour, exactly in 1/2 hour or early. In case the goal is partially achieved or not achieved, again collect data, what and where was gone wrong. Revise or modify the nursing plan of care. Revision includes complete reassessment of the nursing process. Nursing diagnosis that were resolved, need no intervention can be omitted. Gather data to determine if new problem is arisen. Look for all the factors affecting goal attainment. Examine the list of nursing diagnosis and set new priorities. Reassess the accuracy and appropriateness of the framed diagnosis. Makes goals realistic, accurate. Examine the intervention that are identified, change or delete the inappropriate ones. Don't forget to involve clients/family members/health team member while providing care. Incorporate factors leading to successful attainment of goal. Do reevaluation again. Evaluation skill required for nurses. Nurse must know the hospital policies, procedure, and protocols of interventions and recording, etc. Nurse must have up-to-date knowledge and information of many subjects, such as physiology, pathophysiology, biochemistry, psychology, sociology, pharmacology. It helps her to understand client's response. Nurse must have intellectual and technical skill to monitor the effectiveness of nursing interventions. Nurse must have knowledge and skill of collecting subjective data and objective data.
So guys, thanks for watching my video. You can like and comment on my video, but don't forget to subscribe my YouTube channel to watch quality content like this. Thank you guys.